So, hello everyone. So, in this video, we are going to discuss about certain questions regarding the febrile seizures and their management, also about the management of the status epilepticus. So, one of the question is regarding one of the question is that a 2-year-old male child has been brought with history of the fever. That is, 2-year-old male child has been brought with the history of fever since 8 hours, and one generalized the seizure 30 minutes before coming. On examination, seizure has subsided. Child is drowsy but arousable. List 4 differential diagnoses you consider. How will you come to a clinical diagnosis? How will you investigate this child? And what are the investigation helps to confirm the diagnosis? So these are the uh, this is a question which regarding the febrile seizure. That is all these points. That is age group of the child is 2 years. So usually the febrile seizure happens at the age of 6 months to 5 years. That criteria is satisfied. Then there will be history of fever will be there, and within 24 hours of the fever, there will be development of the um, um, the febrile seizure. So that will also indicates the febrile seizure, and also it is less than 15 minutes duration. It is also indicative of the febrile seizure. Then the what are the 4 differential diagnoses you have to uh, uh, right in this case is there will be any intracranial infections, epilepsy, breath holding spells, and also the febrile seizure. These are the 4 differential diagnoses for this case. So then we have to go into the detail about the febrile seizure. So as a definition, the febrile seizure, which refers to seizure that is associated with the high grade fever, as the name indicates, that associated with the high grade fever of 38 degrees Celsius or 100 not 100 0.4 degree Fahrenheit or higher, occurring in the neurologically healthy children between, that is, this is the important term, that is in a neurologically healthy children between 6 months and 5 years of age, without underlying, this is also important, without underlying intracranial infection and without history of the prior unprovoked seizure. So these are the definition for the febrile seizure. That is the seizure which referred to, it is seizure associated with the high grade fever of 38 degrees Celsius or the 100.4 degrees Fahrenheit or higher, occurring in the neurologically, that is the most important, is neurologically healthy children between 6 months and 5 years of age, without underlying intracranial infection or without history of the prior unprovoked seizure. So what are the points should be kept in mind is that fever of 38 degrees Celsius, then neurologically healthy children, age group is 6 months to 5 years of age, then without underlying intracranial infection and without history of the prior unprovoked seizure. So these are the definition of the febrile seizure. The most important point is fever, then neurologically healthy children, age group is 6 months to 5 years, then this is. As per Association of Child Neurology, definition is condition with a fever and seizure in age group 6 months to 6 years. Fever is greater than 38.4 degrees Celsius or 101 degree Fahrenheit without evidence of venous infection or electrolyte of the metabolic abnormalities. There is no history of preceding trauma or the febrile seizure. That is the according to Child Neurology Association. This is the definition. So there are different types of this. So in the essay question, there will be also asked about the types of the febrile seizure. There will be complex febrile, simple febrile seizure, complex febrile seizure, and febrile status epilepticus. A simple febrile seizure, it is a primary generalized, usually tonic-clonic attack associated with a fever. It is lasting for a maximum of the 50 minutes and not recurrent within a 24-hour period. And a complex febrile seizure, it is more prolonged. That is the simple is only for the maximum of 15 minutes, but it's not, it is more prolonged, that is greater than 50 minutes duration, and its focal and or reoccurs within 24 hours. But this the simple is not recurrent within 24-hour period. So this is then about the febrile status epilepticus. It is lasting longer than 30 minutes, not only 50 minutes. It is lasting more than 30 minutes, and some use the term simple febrile seizure plus for those with a recurrent febrile seizure within 24 hours. That is all regarding the type. That is simple febrile seizure less than 50 minutes and does not recur within 24 hours. Complex febrile seizure that is like greater than 50 minutes and reoccurs within 24 hours. And febrile status epilepticus, which means it lasting longer than 30 minutes. So that is all regarding the type of the febrile seizure. So this is the tonic phase. That is everything is in the tonic and the clonic phase. Then about the management of the febrile seizure. So the patient present with the tonic phase and this is the clinical features, that is the tonic phase and clonic phase, and also there will be uploading of the eyes or like that. That is the clinical presentation of the febrile seizure. Then about the management, that is we have to first investigate the child and then we have to treat the child. That is in the management is divided into investigation and treatment. In the investigation we have to take in history, examination, and manage acute febrile seizure and acute illness. That is, we have to give the first aid, midazolam, diazepam, diagnose test which are needed, determine the risk factors for the recurrence, and estimate the risk of recurrence of the febrile seizure. So these are the management options. Then counsel the parents about the risk of recurrence and how to provide first aid and manage fever. Determine the risk factors for the later epilepsy. That is, if there is low risk factors, no therapy or the investigation which is necessary. But if there is intermediate to the higher risk is there, that will we have to consider the EEG and the imaging and consider the intermittent oral diazepam or exceptional uses that occur. Continuous therapy is also needed. So this is the management steps. That is steps in the management of these febrile seizure. That is we have to first take history, then take done examination, then manage acute febrile seizure and acute illness. First aid, midazolam, diazepam, then determine the risk factors, and according to this risk factor, then treat the condition. So in the history, we have to ask about the presenting complaints, fever, duration, nature adult, and also ask about the seizure. Then history of the presenting illness, detailed history of the fever, seizures onset within 24 hours of fever duration. And in the type, the focal or type, we have to ask about the type of the seizure, that is focal or generalized, and associated history of the head trauma and aura is also should be asked for in the history. And also we have to ask in the past history about the previous episode, history of any seizure following the drug intake, and also ask about the developmental history, any delay in the attaining milestone. That is in the case of atypical seizure. So if we answer the question in a practical manner also, it will score a good marks. So likewise, so first we have to take history, then we have to go for examination. In the general examination for the pallor-icterus cyanosis, clubbing edema, lymphadenopathy, vitals, then head to foot examination for ear discharge, skin hyperpigmentation, nail changes for the iron deficiency, and rashes over the body. And then also we have to go for systemic examination. In the respiratory system, there will be high chance of the aspiration pneumonia during the seizure. And in the GIT, we have organomegaly, and the CNS, there will be irritable apathetic in the meningitis child. And to rule out the meningitis. And also ask about the any involuntary movements. That is all regarding the examination. Then about the investigations, the lumbar puncture should be done to rule out the meningitis. That is, the definition itself shows that is without the presence of intracranial infection. So to rule out the meningitis, we have to go for lumbar puncture. And the indication is children less than 6 months after first episode of seizure, 6 months to 1 year children who are not immunized with the Haemophilus influenza type B and pneumococcal vaccine. If the immunization status is unknown and whether meningitis is suspected, history of treatment with antibiotics to be ruled out as it would mask symptoms of meningitis. So these are the conditions where these three are the indications to go for lumbar puncture to rule out the meningitis. Then after lumbar puncture, we have to go for the EEG, restricted to special cases in which epilepsy is highly suspected. That is only in that cases only we will have to go for the EEG. To delineate the type of epilepsy, we have to go for electroencephalogram. And if the patient does not recover immediately from a seizure, then an EEG can help distinguish between ongoing seizure activity and prolonged post-seizure period. That is non-epileptic twilight state. So for these purposes, we have to go for EEG. That is only which epilepsy is highly suspected, only in the restricted such cases we have to go for EEG. Then we have to go for blood examination like blood testers to rule out the infection, CBC, total count, differential count, and ESR, blood electrolytes, sodium, potassium, um, um, and calcium, magnesium, and the blood glucose, peripheral smear. And we have to go for iron studies, LFT, RFT, neuroimaging, not indicated in the patient with a simple febrile seizure, indicate the patient with having complex febrile seizure if he is neurologically abnormal, and rule out extracranial causes also. Then about this, so that is all about the investigation, history, examination, both general examination and systemic examination. Then about the investigation like lumbar puncture, then EEG, then blood investigations, LFT, RFT, iron study, etc. Then about the treatment of the febrile seizure. The treatment of acute episode terminated by IV lorazepam or the midazolam, reduction of temperature by the antipyretics, and if there is febrile status epilepticus, treatment regimen is. So this is the treatment regimen for the febrile status epilepticus. So it is also the treatment regimen for the in the case of status epilepticus. So the management of the febrile seizure in the acute episode and also the management of the status epilepticus is same. So we have to write this chart in this flow chart in both the cases. That is in the management of the febrile seizure as acute episode and also in the management of the status epilepticus. So first, if there is an acute seizure is present, we have to first maintain the airway, breathing, circulation, and administer oxygen. That is to initially stabilize the patient. Then we have to check for the blood electrolytes like glucose, calcium, magnesium, liver and kidney function test, and blood counts and toxicology if indicated. And then we have to go for the initial episode is terminated by using the IV lorazepam. The dose is 0.1 milligram per kilogram or midazolam 0.1 milligram per kilogram up to 2 doses 5 minutes apart. Correct metabolic abnormality if there is any present. That is like IV glucose, IV hypoglycemia. If hypoglycemia is present, so we have to correct the electrolyte abnormalities and go for the IV lorazepam, or it is not available, we have to go for midazolam. Then if the seizure continues and administer sequentially these like if the seizure continues, we have to give after that we have to give IV phenytoin or phosphenytoin 20 milligram per kilogram infusion and repeat if needed at the 10 milligram per kilogram. And if still the seizure continues, we have to go for the sequential order like that. After the phenytoin, we have to go for the IV sodium valproate 20 to 40 milligram per kilogram infusion. And if again the seizure continues, IV levetiracetam 20 to 60 milligram per kilogram infusion at 5 milligram per kilogram per minute. And then if again the seizure continues, we have to go for IV phenobarbital 20 milligram per kilogram infusion. If repeat if needed, we have to twice at a 10 milligram per kilogram. Then again, if it is not controlled, we have to go for IV midazolam at a 1 to 30 microgram per kilogram per minute infusion. Then the coma induced by the phenobarbital infusion, we have to consider the IV ketamine and oral topiramate. So these are all regarding the sequential sequential administration of the drugs in the case of the acute seizure and also the management of the status epilepticus. So first we have to terminate by the IV lorazepam or the midazolam, and if it is not controlled, we have to go in the sequential manner of these drugs. And if the IV ketamine and oral topiramate is not improve the condition, we have to go for immunotherapy or vagal nerve stimulation, or we have to go for dietary therapy and epilepsy surgery. So that is the all regarding this acute seizure management in the case of febrile seizure, and also it is also we have to return in the case of management of the status epilepticus in these flow chart. Then, then if the question is asked regarding the risk factors or recurrence in the case of febrile seizure, we have to write under the two heading. That's major risk factors and minor risk factors. Major risk factors, the age is less than 18 months and the duration of fever is less than 24 hours and fever between the 30 to 39 degrees Celsius. And if the minor risk factors are family history of febrile seizure, family history of epilepsy, complex febrile seizure, male gender, and low serum sodium at the time of presentation. These are the risk factors of the recurrence of the febrile seizure in the child. Then about that is, along with the treatment, we have to counsel the patients also. That is, parents should be counseled about the relative risk of recurrence of febrile seizure, recurrence of epilepsy, educated on how to handle a seizure, and emotional support. Then about the prophylaxis to prevent the recurrence, we have to give intermittent therapy and continuous therapy. As the intermittent therapy, recurrence reduced by 80%. We indications for the intermittent therapies, three or more febrile seizures in 6 months or four or more febrile seizures in 1 year. These are the indication for the intermittent therapy to prevent the recurrence of the febrile seizure. We have to give the oral benzodiazepines, that is like clobazam, 0.8 to 1 milligram per kilogram per day, or diazepam, 0.6 to 0.8 milligram per kilogram a day in three divided doses, given for 3 days during the fever episode. That is, if a fever episode is present, we have to give it is for 3 days to prevent the febrile seizures to happening. Then another prophylactic therapy is in the form of continuous therapy. Indication is if there is any failure of intermittent therapy or recurrent atypical seizures, when parents are unable to promptly recognize the onset of fever, we have to go for sodium valproate 20 to 30 milligram per kilogram per day, or phenobarbital for 4 to 5 milligram per kilogram per day, one or two divided doses, and we have to give it for the 1 to 2 years until 5 years of age. That is continuous therapy. Not only during this period of fever, we have to give it for the 1 to 2 years until 5 years of age. And if there is a high risk for the later epilepsy, chronic anti-epileptic therapy, which may be considered for the children. So that is all regarding the topic of febrile seizure. Its types and its definition, about the management, that is investigation, and the treatment. In the treatment part, it includes the acute febrile seizure management, then about the counseling, and the prophylaxis, that is intermittent and continuous prophylaxis for the prevention of the recurrence. That is all regarding the febrile seizure. And also we have discussed about the management of the febrile, management of the status epilepticus. It is same as that of the acute febrile seizure management. The flow chart we should be kept in mind. So thank you.